Hi, I'm Justin Riley. Today on Wisconsin Doctors, Hyperbaric Oxygen Therapy. It's a fascinating topic, and there are not too many facilities that provide this type of therapy around. But we're going to be on location at the Wound and Edema Center, part of Fort Healthcare here in Johnson Creek, to find out a little bit more about what is this therapy, how it works, and more importantly, how it's paid for. I'll be joined by Dr. Robert Goldman, who is the medical director for the Wound and Edema Center here at Fort Healthcare. Tricia Abenroth, who is a hyperbaric oxygen tech. She's going to talk to us a little bit about hyperbaric safety. And Deborah Van Omeren, who is going to talk to us a little bit about insurance concerns and staff. That's all coming up right here on Wisconsin Doctors. Stick around. Hey folks, welcome back to Wisconsin Doctors, and we are on location at the Wound and Edema Center, part of Fort Healthcare here in Johnson Creek. And first we'll be talking with Dr. Robert Goldman, who is the medical director for the Wound and Edema Center. Dr. Goldman, how are you?
Pretty good. How are you doing today?
I'm doing excellent. Thanks for having us here again. Good to be back. And we're going to talk a little bit about hyperbaric oxygen therapy, which is a really, really unique topic. You have a state-of-the-art facility here. So first of all, can you explain to viewers what exactly is hyperbaric oxygen therapy?
Well, Justin, hyperbarics helps us with all the complicated wounds that we treat. And the way to understand hyperbaric oxygen is you go back to the word hyper and baric, which means high pressure. And think about the fact that each of us is under a column of air that goes from the space down to where we are at about 1,000 feet above sea level. And that pressure is significant. We don't feel it because we lived in it all our lives. And that pressure, just for the wonks out there, is 15 PSI. Pounds per square inch. So, and the other fun fact is that oxygen makes up about 20% of our atmosphere. The rest of it is other things.
Sure.
So, what hyperbaric oxygen is it doubles the pressure at sea level.
Oh, wow, okay.
So it's now 30 PSI. It's double the pressure from space to here. It's also, if you go down in the water, it's 33 feet of seawater. Mm-hmm. And so what we do is we make it pure oxygen. So the bottom line is we're actually experiencing in the hyperbaric chamber 15 times the oxygen that we would experience at sea level.
And do people feel the difference when they go in there? Do they feel like, yeah, this feels about twice as much pressure as what I'm experiencing?
Well, that'd be one thing that they actually feel maybe like they're landing in an airplane. Like
okay.
The ears may pop a little bit, and that's about it.
Wow, that's great.
Dr. Goldman, can you tell us about your experience with hyperbaric oxygen therapy?
Well, during my training, I did experience hyperbaric oxygen to depth and then back. But I think what's more akin and more helpful is to think about when I was diving. I dived in the Bahamas once. I'm not a diver. And I put on my wetsuit and I got in the water, and over a few minutes I went down to the bottom, which is 33 feet of seawater, which is like the same amount of pressure you have in the hyperbaric chamber, saw the fish and some other things down there, and then walked around for a while, and then came back to the surface. So there's 3 parts in the hyperbaric treatment, which we also call a dive, which is the descent, which may be 5 to 10 minutes, maybe a little longer, the stay at the bottom, which is about 90 minutes, and then the return to the surface, which is the same as the descent in terms of time. And so that's what one would experience in a hyperbaric chamber, and the idea is that you may feel some popping in your ears as you change pressure.
But that has to be done gradually, so that
it has to be done gradually, and we work with Trish to make sure that everybody's comfortable with the level, with the descent and the ascent.
Absolutely.
So, Dr. Goldman, can you share with our viewers how hyperbaric oxygen therapy began in medication?
Well, it actually began in the 19th century. And during that time, people would be building bridges. Remember, the Brooklyn Bridge was built in the 19th century, and workers would have to work under the water. but they didn't. They actually worked in air that was pressurized so water wouldn't rush in. So what they did was, when they came back to the surface and went home, maybe they became sick. And it turns out that that became something called decompression sickness, or the bends as we know it now.
Right.
And that they found that using compressed air, like what we do, but air, actually helped alleviate the bends. And that was really its first use in therapeutics. Now, since then we know more about the science of this. We didn't know anything back then. Hyperbarics has been used for many things not related to science. For instance, it doesn't rejuvenate, and it's not, I just saw a picture last night on the web of Michael Jackson in the hyperbaric chamber. That's not what we use it for. We use it for established scientific practices as approved by Medicare.
So some people, Michael Jackson perhaps used it to rejuvenate his look or whatever, but that's not really what it's used for.
That's not what it's used for.
Yeah.
It's serious business, and everything we do is evidence-based.
Yes, and there's a lot more to talk about, but we got to take a short break. We'll be right back with more Wisconsin Doctors right here at the Wound and Edema Center, part of Fort Healthcare here in Johnson Creek. Stay with us. And welcome back to Wisconsin Doctors. We are so excited to be here on location at the Wound and Edema Clinic, part of Fort Healthcare right here in Johnson Creek. We've been learning a little bit about hyperbarics and hyperbaric oxygen therapy. It's a fascinating topic, and now we're joined by Tricia Abendroth, who is going to talk to us a little bit about hyperbaric safety. Tricia, how are you?
I'm wonderful today, Justin.
Yeah, thanks for having us here. Can you please share with us what a typical hyperbaric appointment looks like?
Well, a typical hyperbaric appointment, they have 5 a week, so I see them Monday through Friday, no weekends. They
5
have
a week, wow.
5 a week.
Okay.
They get the weekends off. We let them sleep in on the weekends. But they'll come on back to the hyperbaric chamber room, and the first thing they do is they usually go in and get changed. I have special gowns that I provide for them. Safety is my #1 priority here.
Yes.
So I provide them with a gown, and they have a cubby that they can place all their belongings, and they get changed, and then they come and they'll sit on the cot, and I'll take their vital signs, and then the doctor will come in and check their lungs and their heart and look in their ears and make sure everything's good to go.
Yeah, so it's important to get a good baseline for as far as
Correct.
their vital signs go.
Correct.
Yeah, absolutely.
And Trish, how do you address concerns that new patients might have as they come to the hyperbaric treatment?
Well, the first thing I do before a patient even starts hyperbarics, before they have that first treatment, is I meet with them and do kind of like a consult. I'll do an Hbo Orientation. And in regards to the orientation, I go over all of the things that are involved with Hbo. So from the safety on down to why we're doing it. Why does the doctor feel it's necessary? And then we cover a lot on safety, a lot of things like they can't wear perfume, they can't wear makeup, they can't wear deodorant, cologne, anything like that, for safety reasons, because when it gets into the chamber and it's pressurized and then with 100% oxygen, it does what they call off-gassing. So that increases the risks. So we want to eliminate as many risks as possible to keep them safe.
That's so interesting, because those are some things that some people just do out of habit and aren't even very mindful about sometimes. You put on deodorant in the morning.
Yep.
So, yeah.
Yep.
It's important to go over those things with the patients.
Correct.
Ahead of time.
Trish, how do you keep people comfortable before, during, and after treatment?
Good
Well,
question.
again, with that orientation, I kind of get a feel for the patient. I try to get to know them a little bit better on a personal level so that I know what their fears may be. Because even though it may seem it's second nature to me,
right.
the fear of going into the chamber may be a little bit overwhelming for them.
Sure.
So I want to address that right away so
Yeah.
that the doctor can maybe give them some medication to make them more comfortable. And so if I have someone that is more on the nervous side, I will try to talk to them throughout the majority of that first treatment.
Yeah.
And make sure that they're comfortable, make small talk, ask questions about their family, things like that to pass the time, so that before they know it, they're done with that first treatment and they realize that maybe it's not so bad and they can get through the rest of them.
Right, and it's so important to be mindful of those who are coming in for the very first time, because that can be a little bit scary, you know, being
Definitely.
in that space. But, you know, you obviously have a knack for making people feel very well at home.
I try.
so
I
that's
try.
good.
I try to make this room look homey back here. I don't want it to look
It
like a
is.
clinic. I don't want it to be institutional. I want it to be kind of their home away from home, because they do spend so much time here. I see them on an average of 5 days a week, from anywhere between 8 to 12 weeks. So we get to know each other pretty well.
Now, you talked about how if 5 days a week you see them. What changes do you observe happening over the course of their series of treatments, from treatment 1 to treatment 5 to 10 and so forth? What kind of changes do you observe in your patients?
Well, that is definitely one of the things I love most about my job, and one of the reasons why I started to do this was the changes that you see happen. You'll see someone that comes in that this is their last hope. They don't know what else to do. That's why they've been sent to us. And they suddenly, after 10 to 20 treatments, they're seeing a difference. The doctor is excited. They can see the changes happening.
Yeah.
It not necessarily is healed within that time period, but they can see the changes happening.
Yeah.
And so the doctor is excited about it. And so the patient realizes that, they maybe could get their life back. So you'll see smiles on their faces when they come through the door. You learn more about their family. So they'll ask you how your weekend was, or you'll ask them how their weekend was. And they realize that we as a clinic care about them, not just for their medical issues, but them as a whole, because in reality, that's what heals a patient, is their attitude. So helping them change that attitude from feeling hopeless to that feeling of, I'm going to get my life back.
That's awesome. And you guys, there really is an atmosphere of truly caring about the patient and trying to help them get their life back here at this clinic. When you walk through the doors, you can feel it. So that's awesome. Tricia Abenrath, thank you so much for the information. It was a pleasure talking with you.
Thank you.
And we got to take a short break. Don't go away. There's more Wisconsin Doctors coming up right after this. Welcome back to Wisconsin Doctors. We are here on location at the Wound and Edema Center, part of Fort Healthcare here in Johnson Creek. And we've been learning a lot today about hyperbaric oxygen therapy. We've learned a little bit about how it works, what a patient can expect when they come in to the hyperbaric oxygen facility. And now we're going to talk again with Dr. Robert Goldman, and we're going to find out exactly how it actually helps the body to heal. So talk to us a little bit, Dr. Goldman, about how hyperbarics actually helps the body to heal.
Well, Justin, it's like this. We have 15 times the normal amount of oxygen
Yeah.
that gets into the bloodstream. It works in many ways on the tissue at risk. It improves bacterial killing because bacteria don't like oxygen. It also helps to get oxygen to areas which don't have a lot of blood flow, like bone. There are other positive features, like it helps the body lay down its scaffolding in order to heal. It does it better with the oxygen than without it. It also helps to form new blood vessels in the area of poor oxygen as well. It also helps protect the body when the oxygen does come back. Sometimes that in itself can hurt the body, and it actually protects against that. So for all those reasons, hyperbarics works to help tissue at risk.
Wow.
Yeah.
That's incredible how it's almost like a rejuvenation center just right inside.
Well, you say it, rejuvenation. You said it.
Yeah, I said it, I guess.
So, Dr. Goldman, how does hyperbaric oxygen help diabetes with complex wounds and with bone infection?
Well, Trish, the thing that you and I treat the most, I think, is the complex diabetic folks that are at risk for limb loss. And there's a lot of reasons why. One is the fact that they have bone infections, they have wounds that don't heal very well, their immune systems don't work. And just as I said before, the hyperbarics helps to rev up all those processes, kills bacteria in there, so that it helps to heal these very difficult wounds for the reasons that are stated. If, for instance, that we can save something, we can actually save most of the leg, so that people can actually walk around and live productive lives with both limbs. So that's one thing. And one thing about hyperbarics is that it reduces the number of diabetic amputations threefold. When it's used in combination with coordinated care from multiple disciplines, there's always a combination of care that's involved. Doesn't all work on its own.
Yeah, and I think that's important for people to know that this isn't, although this is a very, very helpful procedure or therapy, it's not necessarily the miracle silver bullet type of thing. I mean, it has to be with coordinated care, as you had said. So
Right.
important.
That's the science, yes.
Yep.
Dr. Goldman, can you also explain how hyperbarics is used for radiation injury?
Right, so radiation injury, we see a lot of patients that have radiation injury. When we treat cancer, we use big guns, which may cause some other problems. As people know, chemotherapy and radiation are used and can have their own problems and side effects, although they help to kill the cancer. What happens with the radiation is that the tissue around the cancer cells, although it kills the cancer, they get affected too. The blood vessels die away, the body becomes more fibrotic, where it's a lot more stringy protein material that just builds up in that area. So if they were to get wounds, they won't heal so well. Or if bad things happen, they won't heal so well. So two main areas that we treat are people that have had pelvic cancer, which could be prostate or cervical, or it could be head and neck cancer, such as happens on the tongue or the throat. What happens with the pelvic cancer is that they end up getting bleeding. And the bleeding is a real problem, and it could lead to blood loss, transfusions, and other bad problems. Hyperbarics has been shown to improve outcomes and getting rid of that bleeding when really nothing else works well, with minimal side effects, and it can actually decrease by many-fold the chance of that happening, or getting rid of it, 80% chance of getting rid of it. Now for the head and neck, if, for instance, if somebody has in their lower jaw an extraction, this will help them a many-fold reduction in problems after that extraction, such as they don't have exposed bone, body's able to heal much better, even if they've had radiation to that area. So all told, there is a number of very important things that hyperbarics does do for a variety of things after radiation injury and diabetic foot ulcers, and several other things which we, it's too numerous to mention.
Dr. Goldman, thank you so much again for the information. It was a pleasure talking with you. We got to take a short break. We come back, there's more Wisconsin doctors coming up right after this, right at the Wound and Edema Center at Fort Healthcare. Stick around. And welcome back to Wisconsin Doctors. We are on location at the Wound and Edema Center, part of Fort Healthcare here in Johnson Creek. And next we're going to be talking a little bit about some of the insurance concerns that are part of using hyperbaric oxygen therapy. And I'm joined now by Deborah Van Omeren. Welcome, Deb. How are you?
Thank you, Justin. I'm good. Thank you.
Good. So, we've been talking a lot about what the process is for hyperbaric oxygen therapy and how there's multiple therapies that come in 5 days a week and that sort of thing. I mean, a lot of folks might be listening to this and thinking this sounds pretty expensive. How do you go about receiving approvals for this, for your insurance?
It is very expensive. Mm-hmm. That's a very good point. And it's also a huge commitment. Mm-hmm. As Trish had mentioned earlier, it's an average of 2.5 hours a day, 5 days a week for a minimum of 8 weeks. Mm-hmm. So you can imagine the cost that's involved. So what we will do at the front desk prior to them starting their therapy is we'll work with their insurance company to secure those approvals. Mm-hmm. And that happens right after their first evaluation here. Mm-hmm. It takes about 2 weeks to get that approval, and then they are ready to go.
So it sounds to me like you're kind of making the case, helping to make the case for the patient when you call the insurance company and work with them.
And depending on the insurance company, that can go rather smoothly or not.
Yeah.
Sometimes it takes quite a bit of work, but we'll work with them to do that.
Sure,
definitely.
That's awesome.
Mm-hmm.
So, Deb, to avoid any confusion, can you explain how both primary and secondary insurances play a role?
Sure, yeah. Many of our patients that we see here will carry Medicare. So Medicare, we know, covers 80% of their coverage for HBO. But even at 80%, the 20% remaining is quite expensive. So we're going to work with that patient to secure a secondary insurance if they don't already have one. And if they have one, we'll get approvals from both. Okay. Our private insurance companies will generally cover the procedure as long as we get pre-authorization.
Sure.
And again, it's about a 2-week process, but
Yeah. But you get the job done, it
we
sounds
get
like
it done.
here.
Yep.
That's awesome.
Yep.
Deb, do you need a referral from your primary care doctor or another doctor to be seen in our clinic?
No, we don't need a referral. It's always recommended because the more information we have prior to the patient starting here, the better we can be at the get-go. So what we'll do is, we don't have a referral, we'll get whatever information the patient can give us, what doctor they last saw, who's treating them currently, what their condition is, and then we will work with that provider to get as much information in here so that our providers at our clinic can be ready to go before the patient starts. So.
Thank you.
I think that's a really important point to note, is that a lot of folks just assume that the only reason you need a referral to go to a specialty clinic of some sort is for insurance purposes. But really, it's so that the people at the specialty clinic are up to date on as much information as they can about the patient so that they can provide the best care possible.
From the get-go.
Yeah,
Exactly.
Absolutely. So it's important, even though that you don't need to get a referral, that it's a good idea to get one for
Exactly.
sure. So,
Yep.
Okay, now I'm going to give you the chance, Deb, to describe the quality of care that patients can expect to receive here at the Wound and Edema Center.
Good,
Go.
thank you. I'm probably one of the newest members here on staff, and I have to say I'm very, very proud to work with this team of professionals. From the front desk to our nursing staff to our physicians, the care, the dedication, the persistence is just outstanding. When a patient starts here with us, they become a member of our team, of our dedicated family that is working on their care. So we all work together to provide the best care possible in order to get them healed and get their full, healthy life back.
Yeah, I like how you said they're a member of the team as well, because people are really a member of the healthcare team providing healthcare for themselves too.
Exactly.
So, yeah.
Exactly.
Deborah Van Omeren, thank you so much for the information. Thanks for having us here today.
Thank you.
That's all the time we have for Wisconsin Doctors. From all of us here at CW57 and Wisconsin Doctors, we're inviting you to live longer, live better. We'll see you next time.